Kwe, Ulukut Tanse, hello, bonjour. I first want to acknowledge that as I'm in Ottawa, I am speaking to you from the traditional territory of the Algonquin people. Although COVID-19 cases are still high, overall we're seeing a decline in First Nations communities across the country. It was also relative good news when it was confirmed that the new UK variant was not found in Paungasi First Nation or in Cross Lake, Manitoba last week. However, since Cross Lake is still facing more than 200 active COVID-19 cases, the Canadian Armed Forces has been deployed to provide on-the-ground support. They are working with Chief and Council to meet their needs, assisting with creating more isolation spaces, helping with the public health awareness campaign, and supporting frontline workers in their work. In Ontario, in response to a COVID-19 outbreak in Wabaseemoong Independent Nations, we've been actively engaged with the province, the Northwestern Health Unit, Kenora Chiefs Advisory, and the First Nation to ensure immediate measures are taken to reduce the chances of further spread. Looking east, I want to recognize the swift response in the Inuit communities of Makavik, Nunatsiavut, after a possible case of COVID-19 was found last week. The community began testing residents immediately to identify any other cases and prevent the spread. Thankfully, all tests came back negative, and that was the product of hard work in the community. I want to lift up the work that people did to make sure that although it was a scare, this is the work that needs to be done. As of February 23rd, in First Nations communities on reserve, we're aware of 1,443 active cases, which brings us to a total of 20,347 confirmed positive COVID-19 cases. There are 18,684 recovered cases and tragically 220 deaths. Nous continuons de travailler avec les Premières Nations et nos partenaires pour poursuivre de près la situation. Nous devons rester vigilants. Les nouveaux variants de la COVID-19 continuent de représenter une menace pour les communautés des Premières Nations, des Inuits et des Métis. Afin de maintenir le nombre de cas bas et de vacciner le plus grand nombre de personnes possible, nous continuons à travailler sans relâche en collaboration avec les organisations des communautés autochtones. Dans l'ensemble, en date du 23 février, 449 communautés autochtones avaient débuté la vaccination. Le nombre de doses administrées à ce jour est plus de 103 000, avec la Colombie-Britannique et le Québec qui mènent toutes les autres provinces au niveau des personnes autochtones vaccinées. Félicitations à la Colombie-Britannique et au Québec. Along with vaccinating Indigenous communities, we're also supporting vaccine rollout in cities and towns across Canada. Urban Indigenous populations face many, if not the same, systemic barriers to accessing services of those living in isolated or remote communities or on reserve. The National Advisory Committee on Immunization has recommended that all Indigenous adults be a top priority group for vaccination in the second phase of vaccination. This is because Indigenous populations are more vulnerable to the effects of the virus due to unequal access to healthcare and socioeconomic factors. Provinces and territories must continue to engage with Indigenous partners and leadership while we continue the vaccination campaign. Yesterday, I spoke to Chiefs Fox, Greer, and Crowfoot of the Blackfoot Confederacy in Alberta. They have ultra-low temperature freezers ready in place for the Pfizer vaccine and are eagerly awaiting for the allocation of the vaccine from the province. As well, I encourage everyone to read Dr. Teresa Tam's weekly statement, particularly this week's statement, on the importance of prioritizing racialized populations, including Indigenous peoples. Mon ministère travaille en étroite collaboration avec les provinces et les territoires, les partenaires des Premières Nations, des Inuits et des Métis, les centres d'amitié et d'autres organisations communautaires pour soutenir la distribution de vaccins dans les zones urbaines. Notre objectif, bien sûr, est d'accroître l'utilisation du vaccin de VIH à ce qu'il soit disponible dans des endroits accessibles et culturellement sûrs. Jusqu'à présent, à Vancouver, Toronto, Montréal, Winnipeg, Ottawa ont mobilisé des centres de vaccination urbains. L'ajout de cliniques est prévu dans d'autres villes également, notamment à Saskatoon et à Regina. Sur ce point, j'aimerais à nouveau partager quelques exemples récents de la campagne de vaccination à travers le pays. In Ontario last week, hundreds of Indigenous elders in Ottawa got their first shots of the vaccine through the Wabano Centre and the Akasavik Inuit Family Health Team. It's part of a local effort to protect knowledge keepers and holders of tradition and culture. The Northwestern Quebec Cree communities are pairing their vaccination programs with traditional ceremonies and prayers. Incorporating traditional cultural elements in the process has helped reduce any hesitancy and fears of taking the vaccine. In British Columbia, on Vancouver Island, many First Nations have successfully administered second doses of the vaccine 6 weeks after they received the first. Looking north, approximately 95% of eligible residents have at least had one dose in the vaccine in Uluhuktu, Northwest Territories. The second dose arrived last week, and many residents will be completely vaccinated in the coming days. Across the country, we're making progress and slowly flattening the curve. Je tiens à nouveau à saluer le remarquable leadership des communautés autochtones pour avoir coordonné et facilité la distribution de vaccins. Votre leadership a fait une immense différence au cours des derniers mois et a sans aucun doute sauvé des vies. Nous continuerons à compter sur vous pour poursuivre la campagne de vaccination et nous préparer à répondre à la propagation de COVID-19. Nous devons continuer à faire notre part pour assurer la sécurité des uns et des autres et suivre les conseils de nos experts en santé publique. Finally, I would like to take a brief moment to reflect on the progress we've made with First Nations across the country when it comes to access to clean water on reserve. In 2015, we made a commitment to First Nations. It was one to have access to clean and safe drinking water, and we remain committed. We will not stop until all long-term advisories are lifted, regardless of the challenges faced in getting there. That same year, when we came into power, there were 105 long-term drinking water advisories on public systems in First Nations on reserve. Once we began the work, it became clear that transforming water infrastructure on reserves also meant confronting a large system of patchwork policies and historic underfunding. For example, in the case of Shoal Lake 40 First Nation, there wasn't an all-season road to transport construction supplies. Building the road was an immediate priority for the community prior to starting the work on their water infrastructure. Each community has its own set of challenges, and from the beginning, we've worked directly with community leaders to identify and formulate the best path forward in each case. During Budget 2016, we allocated $1.8 billion to improve First Nations access to clean water. On October 2016, 15 long-term water advisories had been lifted. It was a small but important victory. Between November of 2015 and November 2017, 30 long-term water advisories were lifted on public water systems. And on February 2018, the community of Slate Falls Nation marked the 50th lift. Budget 2018 moved to provide an additional $173 million over 3 years to help accelerate progress on lifting drinking water advisories. And during the fall economic statement last fall, we announced an additional $1.5 billion to accelerate the work to lift all long-term drinking water advisories on reserve, bringing the total investments to over $3.5 billion since 2016. Part of this money will also provide reliable and lasting funding to ensure water infrastructure can be maintained in good condition and thus ensuring longer life cycles and more durable systems. This marks an important shift in how we approach water safety as a government. It will also mean problems with the water systems can be caught earlier and will prevent future long-term drinking water advisories. This funding will also support training for water operators and help communities to better retain qualified operators, local operators, for years to come. Brings us to today. We're shy of celebrating the 100th long-term drinking water advisory lift. Additionally, together we've been able to prevent over 175 short-term water advisories from becoming long-term issues. And we can be proud of the work done by First Nations communities, and we are all steadfast in our commitment to continue to increase access to clean water in the long term. While there can be a lot of uncertainty in construction and infrastructure, especially during COVID-19, as we're dealing effectively with the loss of a construction season, our government will always be there. Miigwech, Nakumik, Marcy Cho, thank you and merci. I forgot to introduce, as usual, Dr. Tom Wong, the Chief Medical Officer of Indigenous Services Canada, who will offer some words, as well as Valerie Gideon, Assistant Deputy Minister.
OK, merci beaucoup. Je tiens d'abord à reconnaître que je me trouve sur le territoire non cédé du peuple algonquin. Je veux faire écho à des sentiments exprimés par le Dr. Theresa Tam et ce que les peuples autochtones continuent à faire face aux inégalités existantes, la colonisation, le développement des systèmes de pensionnat, le racisme et la privation socio-économique font partie des facteurs contribuant aux inégalités existantes en matière de santé. La marginalisation des peuples autochtones et les répercussions disproportionnées parmi leur communauté les ont laissés dans une position à un plus grand risque disproportionné qui les rend plus vulnérables à la COVID-19. Currently, no confirmed cases of the COVID-19 variants of concern have been detected within First Nations communities on reserve. But it is just a matter of time. It's not if, but it's when. In order to continue to stop the spread of COVID-19 variants and to prevent outbreaks, it is essential to redouble our efforts and to follow public health measures. As of February the 23rd, a total of 103,771 vaccine doses were administered, reaching 34 doses per 100 adults in First Nations on reserve, Inuit Nunangat, and territories, a rate that's 6 times that of Canada's. I'm glad to see that various provinces and territories have prioritized seniors, healthcare workers, and Indigenous peoples, in some cases, those living in remote and isolated communities, to receive the vaccines in Q1 of the vaccine rollout. Last week, we have seen the National Advisory Committee on Immunization further recommending that all Indigenous adults be vaccinated in Q2. Residents and community members of Wigwaman Terrace, an Indigenous retirement home in Toronto, received COVID vaccinations. The Anishinaabe Health Mobile Unit delivered the Moderna vaccines with the support of the Women's College Hospital. The Ahousaht First Nations in BC vaccinated 92%, and it's over 90% of the eligible population. And cultural leaders worked alongside community members and nurses and health professionals to ensure vaccinations were administered the Ahousaht way. And to Dr. Horan, a Mohawk physician, she has teamed up with elders and a number of healthcare professionals working to connect First Nations, Métis, and Inuit with information and Indigenous-led discussions about the COVID vaccines. The initiative provides information and resources grounded in traditional knowledge and worldviews. With that, I want to thank you all. Miigwech, Nakumek, merci, and marci.
Thank you. We'll now take questions from journalists, one question, one follow-up, and we'll start with questions from the room today. Nous allons maintenant prendre les questions des journalistes, une question et une question du suivi, puis nous allons commencer avec les questions dans la salle. Merci.
Hi, Olivia Stepanovich, CBC News. Minister Miller, I'd like to get your response to the fact that people in Yamatang First Nation, they set up isolation tents in the summertime just to help with overcrowding, but now people are permanently living there, and these tents are canvas tents. They don't have running water, washrooms, and it's getting down to as low as -48 in this community, and people are living there. How is that acceptable, and what is your government planning to do about this?
Well, it isn't acceptable. I think one thing that we've seen through COVID is that the housing shortage, the structural underfunding, undercapitalization of communities is a real medical and health issue. I think we've had, difficulty as a matter of policy in the past thinking of it in those terms, but clearly it isn't new to Canada. This is the reality of many Inuit communities where crowding conditions creates a vector of spread for tuberculosis. So too with COVID, which is a pulmonary disease. And it's clear that we need to act more swiftly, specifically on housing as a government. And that's something that I take to the cabinet table, and many other ministers do as well. That's the medium term. In the short term, you can imagine how we have to be exceedingly careful as to how we support housing in communities that have effectively shut down or closed their borders and are focused on the health and safety of their own people. So where we have had outbreaks, we have moved swiftly to repurpose isolation areas in gyms, community center for people to isolate so that they don't spread COVID. And where we can, where it is possible, to make sure that we have units available. These were discussions that I had with many leaders over Christmas, as there was a huge spike in cases, particularly in Manitoba. So there is a capacity to move swiftly. These, as you highlighted and alluded to, are temporary measures, and they are unacceptable as a permanent solution. I don't think, Val, if you want to talk about Imatang a little more.
They've been very effective at controlling the spread of COVID-19 in the community. Absolutely. They have very few active cases, less than 5. But, the issue that you're raising is a much more sort of systemic one. I mean, we have invested in over 1,000 health infrastructure options and solutions specifically to respond to isolation, testing, screening purposes, as the minister has indicated, and over 70 million has been invested towards that. But these solutions were not meant to address sort of permanent housing needs in communities, and those remain quite significant.
For tomorrow on your department's response to drinking water, ensuring there's clean drinking water in First Nations. I would like to hear from you, Minister Miller. How would you characterize how your department has responded to this? And what, if anything, are you going to be doing differently to make sure there's clean drinking water on reserves going forward?
Yeah, I think this is a question that I will be more than glad to elaborate at some length once I've had a chance to fully review the report. I suspect it will confirm what my team and I have seen when we were asked when I was asked to take on this role. It's been 15 months. Looking at how we deal with water, we made a very important commitment to lift long-term drinking water advisories, and it is a very important one. I think it's an important one for all Canadians, in particular Indigenous peoples that have lived in these unacceptable conditions in many communities. And it is a goal we are focused on. This comes with a lot of issues that are deeply connected to it. One thing I know that is difficult to measure, and I have difficulty measuring, the Auditor General can't measure, is trust. And that is one, it is a persistent challenge that we face. You and I have talked about it in other contexts. And this is something that we have to keep building. I hope that we can learn something through COVID in terms of trust and how we deal with each other and how we deal with our relationships. But it will be an ongoing problem. I do want to speak to it at length, perhaps when I've had more chance to review it and discuss it with my team. I do think that said, we can't shy away from what COVID has done to slowing things down. We can't shy away from the fact that we moved quickly and invested $1.5 billion in the fall economic statement to address and take a more comprehensive view as to how we approach the removal of long-term water advisories.
Good morning, team. Chris Najikoti, CTV National News. There has been issues with getting the proper water treatment plant operators training and hiring, of course. But the other main issue here is providing these operators with the right wage or salary so they will stay in these jobs. They are on call 365 days a year, 24/7. Has the federal government considered in securing proper pay and wages for these water treatment plant operators so they will stay in these jobs? And this is regarding on reserve.
And thanks for the question, Chris. And I've read it in the good work that's been done by the schools of investigative journalism that have come out with a series of articles over the last little while. And I think with a consortium of global and a number of journalists, it represents excellent work. I think that this is something that I've heard from leadership. And it reflects the conversations that the journalists themselves, and in some cases students, have heard and put together and put a lot of work into it over some time. This is something our team has as well been working on. I mean, it's the inevitable conclusion to the comment that someone is paid less on reserve as they are off reserve is it isn't fair. And that compromises this. You can have the state-of-the-art plant, but if the person isn't getting equal pay for equal work, maybe they should get paid more. I don't know. That isn't fair. And who's going to blame that person for wanting to go to a community that may, more often than not, be non-Indigenous and make more money? So the fall economic statement did a number of things. It acknowledged the fact that we need to do more in how we approach the removal of long-term water advisories. That includes comprehensive O&M funding, telling communities, in effect, that we'll be there for the long term and not just until March 2021, when we have achieved a very important goal for the country, a very important political goal for this government, but one that reflects the needs of the community. So the recurring theme has been around operations and maintenance. It's sort of I guess, an accounting word for people behind the scenes that should be getting paid well and paid properly for the work that they do. And often they are the pride of the community because it does take some advanced chemistry and advanced math to operate these facilities. So I totally agree with it. It's work that's ongoing. I will not pretend to you here that it is work that is complete, but we are absolutely working on it in representing the policy shift that we announced in the fall economic statement.
When can changes, so these water operators are paid right, is there a timeline as to when things can change down the road?
I don't have that for you yet. I'd like to see it as soon as possible, but it represents some policy shifts within the department that I, in fairness, have to go back and work on with the team. So we've acknowledged it. We know it exists. We know it's unfair. We're going to change it.
Thanks, Creason. Next question, please.
Chris Reynolds, Canadian Press. Today, the National Association of Friendship Centers is calling on Ottawa to allocate vaccines directly to clinics that serve urban Indigenous communities rather than waiting for provinces to do so. I'm wondering why the federal government is opting not to take this approach and distribute vaccines directly to these clinics that serve Indigenous people in urban communities.
Thanks for the question, Chris. There's a number of reasons, frankly. The first question we pose ourselves as a government is, what's the most effective way to get those vaccines into arms? We know, as the government, what is my effective capacity as a cabinet minister in the federal government to deliver vaccines is first and foremost on reserve and working with the 700 or so Indigenous Services Canada nurses that are working around the clock to make sure that the most vulnerable are getting vaccinated. Now, we know from the ANAICI rules, we know from the statistics coming out of the US, we know out of the statistics that are coming out primarily out of Manitoba that Indigenous peoples in urban settings are just as vulnerable as those that are on reserve. So the work then, the question that I then have to ask myself is, who do we work with to ensure that those people get vaccinated? And clearly the friendship centers are part and parcel of the deployment, particularly the larger lifts in and around the mass vaccination effort, because they know their people. They're culturally sensitive to the realities of urban Indigenous peoples. They may not have the effective resources. And then the question we have to ask ourselves is, who provides them and how quickly can we get them to them? So you can take the approach that the federal government is just going to hold something back and distribute it. But my question then is that the fastest way to get needles into arms? So what we've done, what we know through our works at trilateral tables and with the provinces is if we work with the provinces, those things can get done faster. And there is proof to show that, and we will continue that. Is it perfect? No, but we will absolutely continue to work with those friendship centers and others, because not every the friendship center network is great, but it doesn't have full penetration in all urban centers, and there are optimal institutions that can do that better. But we can't exclude the provinces from that relationship, because you're essentially putting yourself at odds with the people who have the primary responsibility over the medical system in that jurisdiction of choice. So it's a little more complex than saying we're just going to hold your vaccines back and distribute them because we're being asked to do so. It's a little more of a complex relationship that we need to reflect, and that includes the provinces and it includes them being at the table. And it's what we keep working on, mostly out of the public eye, but we're willing to speak about it publicly as well.
would this approach that you outlined amount to an effective guarantee or to ensure that Indigenous people in urban areas do have access to vaccines across the country?
Yeah, I mean, the guarantee is to ensure that Indigenous peoples are being prioritized. And so I guarantee to those people that we will be working with the authorities in place to ensure that what the science is telling us is being implemented on the ground. There are logistical challenges, if highlighted, but it is one that is ever present. I would point you as well to Dr. Tam's weekly report that I mentioned to in my speech that is pushing very hard on ensuring racialized communities are properly vaccinated, because this isn't a matter of policy, it's a matter of science. If you get the people that are most vulnerable and that for various reasons have they themselves become vectors of spread, you're actually preventing the vaccine from propagating, but you can't exclude from that equation the participation of the provincial health systems.
Thanks, Chris. We'll now take questions from the phone. Operator, next question, please.
La prochaine question est de Philippe Vincent Foisy de Radio-Canada. La parole est à vous.
Ministre Miller, je veux revenir sur l'eau potable, le rapport du vérificateur général demain. À quel point vous vous attendez à ce que ce soit critique? Est-ce que ça soit... pensez-vous que ça va être un portrait de ce qui se passait avant que vous arriviez, ou ça va être un portrait de ce qui se passe maintenant, puis à quel point ça va encore... C'est encore difficile maintenant de lever ces avis d'eau potable. Je sais que vous dites qu'il y a du chemin qui a été fait, mais encore aujourd'hui, on sent qu'il y a beaucoup de bâtons dans les roues, puis que ça soit... C'est assez complexe là, que les changements soient pérennes.
Ben, merci Philippe Vincent. Et comme je l'ai dit à Olivier en anglais, je vais attendre à pouvoir complètement lire le rapport en tant que tel. Je m'attends à ce qu'il reflète ce que moi-même j'ai pu constater au sein de mon ministère en arrivant en poste il y a 15 mois. C'est que oui, nous sommes entièrement focusés sur la levée des avis d'ébullition d'eau à long terme, mais il y a beaucoup d'enjeux qui entourent cette discussion. Sachez, et je le rappelle à chaque occasion que je l'ai, que ce n'est pas le gouvernement fédéral qui impose la levée des avis d'ébullition d'eau à long terme, c'est la communauté en tant que telle. Ce que la vérificateur général ne peut pas mesurer, c'est le niveau de méfiance. Moi-même, j'ai de la peine à l'apprécier en ce qui a trait au gouvernement fédéral. L'approche qu'on a, communauté par communauté, c'est d'avoir cette discussion, ce dialogue, de savoir ce que sont les priorités de la communauté. Évidemment, une infrastructure critique comme une usine de traitement des eaux est clairement une priorité, mais ça vient avec beaucoup d'autres enjeux. Et ce sont des enjeux qu'on ne peut pas négliger. Et si on prend une approche qui est fixée uniquement sur cette levée d'ébullition d'eau, on manque en même temps la capacité, l'opportunité, l'occasion d'améliorer la relation, mais aussi d'adresser beaucoup d'enjeux qui, au niveau de la relation, sont très importants, que ça soit qui ne sont pas nécessairement liés à la levée de la vie en tant que telle. Je pense à des priorités que les communautés me communiquent, que ça soit leurs infrastructures critiques qui sont sous-capitalisées et qui le sont et l'ont été depuis des fois des décennies. Alors, je m'attends à ce que le rapport du vérificateur reflète cette réalité, reflète le fait qu'il reste beaucoup de travail à faire, reflète le fait qu'il y a du travail à faire au niveau de cette approche. Une des choses que j'ai entendues maintes fois dans les 15 derniers mois, c'est que il y a une approche une approche qui n'est pas d'ensemble du gouvernement fédéral en ce qui a trait à l'accompagnement des opérateurs. On sait qu'au Québec, il y a un programme fantastique qui fonctionne et qui fait en sorte qu'il n'y a pas d'avis d'ébullition à long terme. Ce n'est pas le cas à travers le pays. On sait que les opérateurs, ceux qui travaillent dans les usines, c'est des gens hautement qualifiés, mais qui sont mal payés. Et que la formule de financement du gouvernement fédéral laisse à désirer, c'est-à-dire c'est une formule de 80-20 qui demande à la communauté de fournir 20 %. C'est quelque chose qu'on a réglé durant l'énoncé économique de l'automne en annonçant un investissement supplémentaire d'1,5 milliard de dollars. Mais c'est clair que je m'attends à ce que le rapport du vérificateur général reflète ce fait.
Philippe, avez-vous... Oh, allez-y.
Oui, je suis bien, inquiétez-vous pas. La question que tout le monde se pose, c'est comment ça se fait que c'est aussi difficile de régler ça. Là, vous venez nous donner quand même quelques pistes. J'aimerais qu'on s'assoie là, 15 mois après votre arrivée, et qu'on regarde les mois qui s'en viennent, les années qui s'en viennent. Quand vous regardez la situation, quelles sont les difficultés, quelles sont les embûches que vous voyez pour les prochaines années? Si vous nous expliquez, là, pour dire, regardez, on veut le réussir, on va sûrement le réussir, mais d'ici là, voici les 3-4 embûches principales qu'il va falloir surmonter. Quelles sont-elles, ces embûches-là, à moyen, court et long terme?
Bien, d'abord et avant tout, Philippe Vincent, déficit de confiance envers le gouvernement fédéral qui persiste à tous les niveaux entre les communautés autochtones et le gouvernement, avec cause. On sait que la sous-capitalisation des infrastructures en eau critique se fait depuis des décennies. Dans le cas de Neskantaga, qui a été hautement médiatisé, ça fait un quart de siècle qu'ils sont dans cette situation. C'est inacceptable. On a fait les investissements requis, mais encore, il y a du travail à faire en ce qui a trait à cette approche d'ensemble avec la communauté, de les appuyer, de s'assurer. Écoutez, une personne qui est sous avis d'ébullition d'eau, ça veut dire que tous les enfants de 25 ans et plus, 25 ans et moins plutôt, n'ont jamais eu accès à de l'eau sûre et sécuritaire. Alors, c'est clair qu'il y a de la méfiance. Donc, question d'avoir cette communication à la communauté pour s'assurer et leur donner cette confiance auquel ils ont droit. J'ai très difficile pour une personne comme moi qui n'a jamais vécu, non autochtone, jamais vécu cette réalité, d'essayer d'offrir des excuses puis des explications pour un quart de siècle de sous-financement. C'est inacceptable et toute excuse que je pourrais présenter, toute cause ne serait pas crédible. Le défi auquel je fais face comme ministère du cabinet, c'est d'assumer cette responsabilité, de m'assurer avec mon équipe que nous avons les investissements en place et que nous avons ces pistes de solutions pour accompagner chaque communauté. Ce que je veux faire, et je pense qu'on est rendu, parce on sera rendu à peut-être en deçà de 40 communautés qui seront encore sous avis d'ébullition d'eau, avec à l'intérieur de ceux-ci une bonne douzaine qui sont prêts à lever leur avis. Je veux être dans une position pour que les Canadiens puissent regarder sur notre site web l'état des choses dans chaque communauté, pour savoir qu'il y a des pistes de solutions, qu'il y a dans chaque communauté un plan. Et puis, ce qui n'a pas été rapporté trop, c'est que dans chaque communauté, il y a un plan de match. Et ce sont des gens qui travaillent excessivement fort pour lever cet avis, pour travailler avec la communauté, pour assurer qu'ils ont de l'eau sûre et sécuritaire. Et c'est la position dans laquelle je vais être à la fin du mois de mars pour que si jamais quelqu'un a des questions sur une communauté en particulier, ils peuvent le savoir pour savoir qu'ils ont un plan de match. Il y a 2 communautés, Shoal Lake 40 que j'ai mentionné en introduction, puis Tyendinaga, Mohawks of the Bay of Quinte, qui ont entre eux deux 13 avis, mais ils ont tous les investissements nécessaires et jusqu'à la dernière vérification, ils étaient très contents avec le plan de match, mais ils vont aller au-delà par plusieurs mois du délai fixé par le gouvernement de mars 2021.
Merci, Philippe Vincent. Prochaine question, s'il vous plaît.
The next question is from Anne Burns-Piper from the Institute for Investigative Journalism. Please go ahead.
Hi, it's Annie Burns-Piper. Good morning, Minister. Thank you for your comment on our team's reporting. This week we published a story which looks at how little data is collected on water-related health outcomes on First Nations. You have admitted that substandard water leaves communities more vulnerable to COVID-19. Given that, what specific steps are you taking to learn more about how water is currently impacting the health of First Nations people?
Yeah, and it is an excellent question. There's an issue of framing here that we need to is different than what you would see, for example, if we were talking about the Minister of Infrastructure or another ministry that doesn't have the primary responsibility in its relationship with Indigenous peoples. The impression, I'm not saying you gave that impression, but the impression that I've heard in certain quarters is that the federal government should be imposing data gathering, should be imposing environmental standards. And we know from decades of mistake that the last thing you should be doing is imposing. The comment I hear is give us the money and get out of the way. It's something that we take to heart and we take to mind whenever we go through the very square policy envelopes that we have still at Indigenous Services Canada and across government. During COVID, we've expanded a lot of these policy categories with, I believe, great results. There is still much work to be done, but when we talk about data, we first and foremost need to talk about Indigenous sovereignty over data and their collection, particularly when it comes to people and their health outcomes. It's something that Manitoba, in particular, the Manitoba chiefs have done quite well with great results. To suggest that the federal government should be imposing these things is wrong. It doesn't reflect the relationship that is necessary to be had between Indigenous peoples. Does it result by the same extent in a lack of information that we can collate and gather centrally? Perhaps. But I believe that if we work in partnership, we can get that data and be able to work with it centrally. When I look at health outcomes, it's very important. It's very important for what we've said as a government in terms of putting forward health legislation. You can't fix what you can't measure. And so there is a particular set of problems. We've had a very important community wellness index that has been very useful for the government, that is the result of StatsCan data and work that we do with communities to get their data back from us on every 3 years, Val? The Community Health Index. So every 3 years, I don't believe that it necessarily measures water indicators as well as what you are perhaps suggesting we should do, but I certainly think it's something to discuss and to consider further as we move forward, because that is data that can help. If you have, we know that water insecurity in communities is often reflective of general wellness in a community. We know that from our experience in Grassy Narrows. So I leave it at that, knowing that that's an incomplete answer, but very important to have that framing.
Annie, do you have a follow-up?
Yes. We presented your office with research that showed that First Nations communities with truck-to-cistern systems face twice the risk of COVID-19. What steps is your department taking to learn why this may be happening?
You know, when we last talked, I asked you for that report. I think that was a few weeks ago, and I think it's actually very important that we get that data and take a look at it. I understand that there are issues with how water gets delivered, whether it's piped directly from the plant or into cisterns. But again, that data is important. I haven't seen it yet, and if you haven't, we talked about it during that interview. But I would be very, very eager to review it myself, because it is data that is always helpful to have, and I'd be glad to review it.
Thanks, Annie. Operator, next question, please.
Thank you. The next question is from Willow Fiddler from Globe and Mail. Please go ahead.
Hi, good morning. First question for Dr. Wong and Minister Miller. You say it's just a matter of time before the variants get into the First Nations. I'm wondering, what will that do to the curve that you say is flattening across the country? And can people expect that to be the third wave?
I'll let Tom go first.
Yeah, thank you very much, for the question. We're very concerned, and I think every Canadian needs to be concerned about the new variants. One of the things that we have to remind ourselves is that there are tools, there are public health tools. It's adherence to those public health measures. We're still seeing individuals participating in large gatherings without masks, 200, 300 people. We are still seeing people going to parties, for example. And those are things that we must redouble our efforts. And each individual, all of us, in all communities, in the cities, we need to double down on the efforts. And we know that public health measures work. And in addition to that, there's the vaccine, and more vaccines are coming into Canada, as Dr. Tam and Major General Fortin have said, coming into Canada in the coming weeks, in the coming months. When there's vaccine in the community, it's so important, to listen to the vaccine champions in the communities, discuss with the champions, about what we know about the vaccines and how it could help, the spread of the virus and to protect ourselves. And all of those are extremely important. When I said that it's just a matter of time, when it gets to northern communities, and when we look at all over Canada, right now, there's a spread of the variants of concern in different parts of Canada. And we want to actually make sure that there's no complacency, because there's a constant traffic between the north and the south, and it's just a matter of time before the first case, will be showing up in whether it's First Nations, Inuit, or Métis communities. Thank you. And Minister.
Yeah, just briefly to add on, as Tom said, it's not a matter of if, it's a matter of when, and it wouldn't surprise me that we get confirmation that there are variants of concern in Indigenous communities. The potential consequences can be devastating for the reasons that you, Willow, have documented in the past, historical inequities. This virus can spread very quickly, and we have the data now from what we've seen in particular in the United States to prove it. And a variant of concern will require us, and will require to everyone, to mobilize an immense amount of assets to do things that we don't have to do in non-Indigenous communities because those historical inequities are not there. Every COVID case is not the same. It is in a northern and remote community that has a population per household that exceeds 5, 6, 7, 8, 9, 10. It's a tinderbox, and it can be devastating for a community. I did point to the U.S., but we had our own experience in Shamattawa where the positivity levels were well exceeding 50% over Christmas, and that was super scary. I want to take the opportunity to thank all the pandemic teams, Indigenous-led pandemic teams in the armed forces for standing ready, because if there is a third wave and it's variant-driven, it could be more devastating than the second.
Willow, do you have a follow-up?
Thanks. Yeah, I have a follow-up. I just received this a few minutes ago, actually, but Neskantaga First Nation is now declaring a state of emergency for its off-reserve members in the middle of an outbreak, they say, COVID outbreak. So they're saying 6% of their off-reserve population is testing positive, with 12, that being 12 members, one in critical condition in the Thunder Bay Hospital, calling on Indigenous Services to fund emergency housing to accommodate the homeless population who have been forced off-reserve to a lack of housing. Do you have a comment or response to that? How prepared are you to offer assistance?
Yeah, well, we're prepared to offer any and all assistance. We've been in pretty tight contact with authorities in Thunder Bay. I think I'll pass it over to Valerie Gideon if she has any information on that.
Not specifically about members of Neskantaga, but certainly we've had outreach to Particularly, the request for us was around a health human resource capacity, additional capacity to support the city of Thunder Bay that are experiencing a rising number of cases. So as the minister noted, we certainly will be connected to their emergency operations teams to look at whatever it is that we can do. And throughout this pandemic, we have funded supports for First Nations that are living away from communities through various organizations that serve their needs in urban centers or even in northern Saskatchewan, for example, where we were able to support the La Loche broader community during their outbreak situation. So we certainly do have some funding resources that we can leverage in order to be able to provide support to First Nations that are living away and are feeling either are directly affected by COVID or are feeling extremely vulnerable to an outbreak situation there.
Thanks, Willow. And this concludes today's press conference. Ceci met fin à la conférence de presse. Merci.